We are live now. Yeah.
Namaskar, respected panelists and the viewers who have joined us online. A very warm welcome, a very good evening to all of you. Today we will be starting with the first webinar on under the series Integrative Medicines for All. And the topic is intrauterine fetal program is the key to Supraja. I, on behalf of Vivekanand Global Health Gauhati and Dirgayu Treatment Kalyan, extend a very, very warm welcome to all the panelists, the doctors, professors of Ayurvedic College, other viewers, participants who have joined us from all the part of the, I could say like pan India, all covering most of the states of India. We are having participants today. Some of us maybe they'll be joining us eventually. The topic today is very, very of my own personal interest. And if we see a broader view also for everyone, this is a very, very important topic which we have chosen as the first webinar. And I'm the moderator, I'm very overwhelmed because I got good results through Ayurveda, through modern, everything integrated. We have such eminent panelists today who will be, telling us about this interesting topic. And I would request Dr. Amit Mishra, sir, to kindly, in detail, just tell us about the topic, what actually we will be talking about today through our various different panelists. Sir, please.
Yeah. So I will be sharing the theme of today's topic. So what I'll be doing is I will be having a mix of English and Hindi. So कुछ जो लोग हिंदी ज़्यादा समझते हैं तो उनके लिए भी ये इजी रहेगा. हम आज बात करेंगे लो बर्थ वेट यानी कि LBW. ऐसे बच्चे जिनका वजन जो है जन्म के समय 2.5 किलो से कम रहता है. और अगर हम हिंदुस्तान में ये देखें या डेवलपिंग कंट्रीज में देखें तो करीब करीब 40% इस तरह से बच्चे हैं जिनका कि वजन 2.5 किलो से कम रहता है. अब इनमें क्या होता है, क्योंकि इनका वजन कम रहता है तो इसीलिए इनमें मोर्टेलिटी रेट यानी कि डेथ होने की संभावना जो है वो ज़्यादा रहती है. ये लो बर्थ वेट यानी कि LBW जो हम बोलते हैं ये इसीलिए है क्योंकि उनकी जो ग्रोथ है उस समय वो अच्छी नहीं हो पाती, जिसे हम इंट्रा यूट्राइन ग्रोथ रेस्ट्रिक्शंस या IUGR कहते हैं. ये कई बार इसीलिए भी होता है क्योंकि डिलीवरी 9 महीने से पहले हो जाती है, जिसे हम प्री टर्म डिलीवरी कहते हैं. तो हिंदुस्तान में जो जितने भी LBW लो बर्थ वेट जो इन्फेंट्स होते हैं उनका सबसे ज़्यादा जो कारण है वो IUGR की वजह से ही है. और इसीलिए इसमें भी अगर देखें हमारे यहाँ पे हिंदुस्तान में तो वो इसीलिए क्योंकि माँ को उस समय यानी कि प्रेगनेंसी के दौरान अच्छा न्यूट्रिशन नहीं मिलता है. और यही कारण है कि प्री प्रेगनेंसी यानी कि प्रेगनेंसी होने के पहले और ड्यूरिंग प्रेगनेंसी दोनों समय उनका वजन बहुत कम होता है. तो इसीलिए टुडे वी विल बी ट्राइंग टू सी दैट द पुअर मैटरनिटी न्यूट्रिशन एंड द फैक्टर्स फॉर द IUGR. The tragedy for LBW is that these infants grow up later to give to other LBW infants themselves. यानी कि इस तरह के जो बच्चे जिनका वजन कम था वो जब खुद माँ बन के जब डिलीवरी करने जाते हैं तो उनके बच्चे भी लो बर्थ वेट के रहते हैं. तो ये एक साइकिल है जिसमें से हम कैसे निकलना है वो बहुत जरूरी है. तो दिस इज द कॉज फॉर स्मॉलर बर्थ वेट्स in our country. Increasing the birth weight of the infants increases the birth weight of the subsequent offspring from that mother. It also decreases the infant's risk of developing chronic diseases such as diabetes and hypertension later in the life. Professor Barker has proved this fact through his research covering 5 continents. Adequate maternal nutrition, including the intake of micronutrients, amino acid, antioxidant, increases the birth weight. Developing safe and effective interventions to enhance nutrition among the pregnant women at the risk of IUGR in India is not only critical but also important for improving the infant outcome, for promoting health and productivity of India's future. The mother's womb is the key to the prevention of national health care. For the first time in 1901, the concept of antenatal care was instituted in modern medicine. और अगर हम आयुर्वेद में देखें तो ये तो हमारी संस्कृत का एक हिस्सा है, गर्भिणी परिचर्या के रूप में। और इसीलिए हम एक सुजात, एक अच्छी बेबी होने का एक सपना हर माँ का रहता है। तो ज़्यादा समय नहीं लेते हुए I'll go back to Dr. Shalini to introduce our panelists who will are here to guide us.
So these panelists don't need any introduction, still following the protocol. I would like to introduce firstly Dr. H.S. Paleb sir. Dr. Hanmantrao Paleb was born on 14th November 1938 in the state of Telangana. He did his GFAM, also known as Ayurved Nishnat, from Maharashtra University in 1962 with first class first. He later did MBBS, DGO and MD from Bombay University. He had been national professor and visiting scientist at Hopkins Institute of Research and Testing, Mumbai. He was associated with many Ayurvedic colleges and in various capacities in Maharashtra and Hyderabad. The most distinguished feature about him is that he is the only recognized teacher at the Mumbai University in both modern medicine and Ayurvedic faculty. He's conducted many Ayurvedic courses in USA organized jointly by Ayush and AAPI. He's done a lot of research on improving fetal outcomes. He has a lot of research paper in his names. Presently, he is working as consultant ONG, Dr. Paleb's Priyank Nursing Home, Mumbai. He's trustee at Dr. Paleb's Medical Education and Research Trust and director at Dr. Paleb's Medical Research Foundation. Sir, going through your CV was a real eye-opener because you have integrated modern and Ayurvedic medicine so beautifully. Sir, दिल से आपको धन्यवाद. आपका इंट्रोडक्शन देते हुए मुझे बहुत अच्छा लग रहा है. मतलब मेरे लिए एक सम्मान की बात हो गई कि आपका मैं इंट्रोडक्शन दे रही हूँ. Coming to our next speaker, Dr. Sheetal Dattatray. She is Assistant Professor, Department of Dravya Gun, N.K. Jabshetty, AMC and PG Center, Bidar, Karnataka. She is MD Dravya Gun and has done MSc in clinical research. She has worked as Ayurvedic consultant for 12 years in Sushrut Ayurvedic Hospital and Research Center, Udgir. She has a lot of research papers under her name and has keen interest in women's well-being through Ayurveda. Thank you, ma'am, for being here as a panelist. I would be introducing to you all to Dr. Shelar. She's MD OMG from Seth GS Medical College, KEM Hospital, Mumbai. Presently, she's practicing as gynecologist at Shelar Hospital, Kalyan since 2004. Welcome, ma'am, to the panel. Lastly, I would like to introduce Dr. Amit Mishra, sir. My pleasure introducing you, sir. He is an Ayurveda medical graduate and PhD yoga scholar. He has over 20 years of experience in Ayurveda, Panchkarma, yoga, clinical yoga, and teaching yoga courses. In 2018, he made a paper presentation on breast cancer at the Harvard Medical School, Boston, and last year was invited by Health University of Guadalajara, Mexico for special yoga event. He is currently engaged in a year-long project on diabetes and Ayurveda. He's a very dynamic personality as I know him. Sir, we're looking forward to your talk today. I must say, what a gem of panelists today we have. This is going to be a wonderful session. And I hope we all will be learning a lot from all of you. We will be moving ahead with, sir, Dr. Paleb, sir, may I request you to present your keynote address, sir, please.
Yeah, so thank you for the wonderful introduction. Yes, sir, I'll also like to welcome from Bharat Vikas Parishad. Kalyani group is there. Dr. Meera Mishra ji and her group is here. So I welcome them. I also welcome from Gauhati Ayurvedic College, the Prasuti Tantra department. Vol is here. So I also welcome them to this particular program. Benny madam is there. So we will be having very much a lot of queries from their sides also coming up. So over to you, sir. Thank you, sir.
Thank you very much, Dr. Mishra and Dr. Shalini for introduction, the theme, as well as me personally. It's a pleasure to be part of you all. Amit has been very close to me for years, and so also now I know that Assam also we have a lot of followers, what I can see. So let's understand the whole problem. Today, what I'm going to talk is a national problem. What's our national problem? Now, our national problem, why it's not moving? This screen is not moving. Can something be done from your side? Screen is not moving. Ashutosh?
Okay. Till the time sir gets back to this, I will. Yes, sir.
One second. स्क्रीन नहीं ये नहीं बज रहा है
क्या चाहिए
नेक्स्ट स्लाइड चाहिए ना
ये दबाने में
ये दबा
आगे आगे
sorry for this little problem, technical problem.
No problem, sir.
Today we find 1 out of the 3 of the population, 1.3 billion population of India, have chronic disorders like hypertension, diabetes, adolescent obesity, middle-age obesity, chronic cardiovascular and renal problems. These occupy almost most of the healthcare expenditure of this country. Now, what we see here, the problem is how does this problem, the management of this, where does it start? So to look into this issue, we need to understand that in our country, there is yet another important problem. As Dr. Mishra already talked about low birth weight. Now, India is one country, we have lower birth weights compared to any other country in the world. Can you imagine even worst malnourished country like Ethiopia has a better birth weight than India? Now, what is the reason of this is what we need to learn. And whether this has got any direct relation to middle-age diseases that we are now trying to understand. And this low birth weight is 2 types of low birth weights. One, there can be preterm deliveries which happen. And second is there is a growth retardation happening in the uterus, and that may be another reason why there is a growth retardation. And there is one third interesting factor which you see, that most of our pregnancies do not reach 40 weeks as normally should. Most of them deliver around 38 weeks. Now, this is one of the most important things that makes our birth weights much less. Because in the last trimester, the birth weights increase, and which doesn't happen. There is a lag of almost 2 weeks in most of the normal pregnancies. I'm not talking about birth weights of preterm deliveries or growth deficient babies. Now, I'm showing a study done in Singapore by Dr. Thambiracha. In that, there are 3 populations in Singapore. One is Indian, other is Chinese, and there are Malays. Now, normal birth weight of other communities is around 3,500 grams. In compared to that, the Indian average birth weight is 2,500 grams, and many of them less than 2,500 grams. So now you can understand that there is something seriously wrong with our whole generations of Indians putting out small babies. Because, as Dr. Mishra already told you, that one generation of low birth weight will give the next generation low birth weight. And this has been happening over ages. And that's the reason why in India our birth weights are low. Even those Indians who went to America or any other country, there also they have the same problem. And in order to change this, probably better nutrition, better health care, better antenatal care would make this change. It will take some generations to change this. So it's not an easy thing that you do something and suddenly something will happen. So we need to work very hard. And how do we change this? Now, there was a very interesting study by Professor David Barker from Southampton Studies. They worked in 5 continents. Can you imagine they worked in India also? And they selected a hospital in Mysore. And this hospital maintained records for last more than about 100 years, birth weights. And from each and every person who has hypertension, blood pressure, blood sugar levels high, diabetes, and other ailments, they went into their birth history and they found out that all of them were low birth weights. So there was a correlation. So correlation was established not in one country, one place, but all over the globe. So that means you can understand, see, there is a direct connection between the low birth weight and all these middle-age diseases. Isn't it very interesting? So that means the key to the problem of whole of these healthcare issues rest in the mother's womb. And in order to do anything proper that we can change this scenario, we need to think about this and take steps. Now you can see that we have antenatal care almost from 1901, now more than about 120 years now. Has it made a change in India? Not much. So where are we lacking? What is happening? Let's try to understand this. Ayurveda talked of Garbhini Paricharya thousands of years ago. They talked of Supraja and Sreshthamapatyam. They wanted a well-born designer baby. Now, what does that mean? What is a well-born baby means? Charaka so succinctly describes this. Very interesting. Charaka says, aroga, without disease, arogya. See the difference. Two different words, aroga and arogya. Arogya is a positive health. Balas, the baby should be strong. Varna, complexion. Swara, voice. How loudly the baby cries after the birth. That's very interesting, the voice. Samvahana, well nourished. And such a child says, Jatinam Sreshtam Apatnyam Janayati. When you do a proper Garbhini Paricharya, you will be able to get a baby who is Jatinam Sreshtam. In the race, superior most. What does that mean? Both intellectually and physically. So this baby is going to be Sreshtam Apatyam, a well-born Sujat baby. This will be a Sujat baby. Now, Charaka also describes the various contributions for this Sujat baby. How this Sujat well-born baby can be born, what are the various mechanisms which are require to be contributing to this baby. He talks of contributions from mother, Matruja, contribution from father, Pitruja. Then he talks of Atmaja. Now, what do you understand by Atmaja? You know, it was, I was having a problem teaching Podar students Shukra Shonita Samyoga. Garbha is not what it is, what Ayurveda talks. Shukra Shonita Atma Samyoga Garbha. It was very easy for me to teach in modern medical college, in the grand medical college, to tell them the sperm and egg union resulted into an embryo. That was very easy for me. But what do I talk of Atma? We'll discuss that little later. And I would consider the genomic development where a child gets its own genome from both the mother and father. It takes the parts of that and that gives a genome which is absolutely specific for that child. That is what I consider as Atmaja. And then comes Sattvaja, the mind. Development of mind development is the most important aspect of the fetal development. Then talks of Rasaja. Rasaja is a feto-placental circulation, the nutrition of the fetus, Rasaja. And Satmaja, when you talk of Satmaja, means congeniality of the environment of the baby. In what type of the environment the baby is. That is Satmaja. So these are 6 contributions. Shed Bhava, 6 bhavas which make the baby grow in the womb. Now, how do we present it in the modern way? Now, this can be made into, excuse me,
Dr. Saab. No.
sorry. So there are 3 phases of the intrauterine growth. One is gene imprinting and genome formation, the first phase. The second phase is organogenesis and brain development. The third phase is muscle and fat development in the body of the fetus. Now let us talk about the first phase, which is called genomic script. Now, how many of us know that in our culture, they say that there is something called Brahma Lake or Vidhata, which happens in the first 6 days of the birth. But it is not after the birth. It is after the conception. Now, what happens in the first 6 days? This is the period of implantation of the embryo, during which the genome is organized. Now, what do we mean by this? Half the chromosomes of the mother and half the chromosomes of the father, they are mixed and matched. And the embryo gets its own genome. And that is specific for that. And this genome determines the whole potential of an individual for lifetime. That means whether he will be a doctor, whether he'll be a what, the potential is determined in this first 6 days of the conception, not after the birth. So therefore, genetic potential happens after the genomic formation. Now, another interesting aspect which I would like to discuss with you, it is the father who is responsible for the generations to come, not the mother. Why it is so? Because the sperm contains the centriole, and the centriole is the organizer of chromosomes. Centriole, which will form the genome, the centriole forms the genome. 1 second. Disturbance of being at home and nobody else to attend. And the mitochondria is the maternal origin, which is called Agneya in Ayurveda. So when we discuss all these points, what insights Ayurveda had, that generations will be always be after the father, not after the mother. This is very interesting. Now, what is this genes carry? Genes carry the information from ages when the first sperm and egg united. It continued from generation to generation as a chemical memory in the DNA. Now you can understand, when you say you are born with already the knowledge, the information, when you are born itself, you already have this with you. You don't learn more. What you do is you already, whatever that is, you could be able to process that better or not. That's all. So your knowledge is already ingrained. It has been put in you through your genome, and which is there as a storehouse for you. It's a library of information. Now, second phase is the brain development and development of all the organs. Now, this is the most important phase. Now, if during this phase, if the development does not occur, then what happens? So you lose in so many organs developmental failure. You will have a small brain, small liver, small kidney. So therefore, this is the most important phase of your life. So 4 to 14 weeks of pregnancy is one of the most important things. If you remember your Ayurveda, Charaka prescribes cold milk, prescribes milk whey, prescribes ghee to improve your brain content. Ghrutam buddhi vardhakam is what actually said in your text, and it gives you a lot of DHA in large amounts. The brain, retina, all the neural tissues require DHA, and this is present in your ghee. Omega-3 fatty acids, then these are present in cold water fish, pumpkin seeds, linseeds, dark green vegetables. So these are very important at this second phase. And the third phase, the last 3 months, the third trimester, in the first half of that, there is a good muscle development happens. And the late gestation, the fat development happens. Fat deposition. not development, but it would be deposition. Now, this, if you look at the Indian babies and compare to the other communities, other Caucasian and Negroid and Chinese and all this, you'll find Indian babies are more fatty babies, not muscular. So that is the difference between the Indian baby and the others. So what are the causes? Poverty, malnutrition, social deprivation, adversities in the life, they cause prenatal fetal experience. The fetus undergoes, because of this abnormal situation, undergoes its own experience. And that experience interferes with the fetal genome too. And there will be altered intrauterine fetal growth program. So all this fetal growth occurs through a program, and this program gets altered. Now, we need to understand what is the most important period of all this is the first trimester. Up to 14 weeks, whatever you can do, you should do your best in that period. Now, unfortunately, most women come to a gynecologist or a obstetrician after that period, not before that. Today, of course, more are coming early, but most of the people come for antenatal registration after 4 or 5 months. So that's in the second part, second phase. But the first phase is important because this is the time, the brain growth period. So the metabolic investment in this period is the most important issue. And if this investment does not occur, so there will be handicap in episodic learning, memory, inhibited child syndrome. These are all our possibilities. So therefore, family support, psychological support through various means, including Garbhasanskar. Most of the people start Garbhasanskar late, but I think Garbhasanskar should be started right in the period of the first trimester or even before, even pre-pregnancy. Also, proper counseling, proper psychological support to the mother is what is important. And one more important thing I must point out here, mean body composition of the mother. Whatever the mother nutrition she gets, that gives her the body composition. Only her, out of her body composition, she can give the nutrition to the baby. If that composition is poor, your investment into the baby, the mother's investment into the baby becomes less, and therefore you get all small structures, small number of cells in each of the organ, and that's how you have small babies. Now, malnutrition and stress. If there is additionally, one side there is a nutrition issue, and second is the economical and other issues put lot of mental stress. Now, how can that affect? So, the microarchitectural damage to the brain, and that leads to limbic system damage, dissociated personality, behavioral disorders, fear reaction, cognitive problems, dysthymia, addictive behaviors. These are various problems that can occur because of this. And for this, what is the reason? The placenta is not only supplying nutrition, but it produces so many hormones. Corticotrophin releasing hormone is very important organ, important hormone, like in maternal hypothalamo pituitary axis producing ACTH and other hormones, etc. There are so many stress hormones, and because of that, you will find the growth hormone is affected, thyroid hormone is affected, reproductive hormones are affected. There will be poor immunity. There is the issue of immunity also. So, therefore, we need to look at these various problems and how can we avoid them. Now, Dr. Agnik in Pune did a wonderful work. He gave mothers proteins, carbohydrates, vitamins, all that he gave. And in another group, he added to that vegetables, green vegetables. Now, those groups which received green vegetables showed a much better weight than the other group. So, alone giving vitamin, iron, calcium may not be sufficient. You must remember the only way to give micronutrients is through herb roots, the vegetables. Now, herb roots are one of the biggest sources of micronutrients. You know that in Chavanprash, there are 50 herbs, many of them are roots. Why it's so? This is the intelligent way of using nature and its properties. Now, active prevention of intrauterine growth retardation can be possibly handled through proper nutrition, education, empowerment of women with prevention of social and personal stress. So these are the key things, key factors in prevention. Now, try to understand that immunology is the key to the pregnancy. You know, after all, fetus is a foreign body to the mother. And normally, foreign bodies are expelled. It's a miracle of the nature that fetus is kept for 9 months in the body of the mother. And that's only possible because there are mechanisms which will not allow that immune response, which will end in an abortion or something like that. So therefore, Ayurvedic rasayanas. So when you say what is a rasayana, how do they act? They're excellent antioxidant, anti-inflammatory, and immunomodulation. All the three factors are present in the rasayana. There are some rasayanas which we say Jivani rasayana. You know what is Jivani rasayana? What is Jivaniya? Life giving. Who gives life? God gives you life. Who takes away the life? God takes away your life. This is our common concept, isn't it? Here, in fact, it is the oxygen which gives you life. And the very oxygen takes away your life. Can you believe that? The free oxygen radicals take away your life. When there is a free radicals are generated, they cause the damage and they kill free radicals. So when you talk of Jivaniya, I am talking of antioxidant properties of these herbs. Balya, Medhya, mind promoting. So now we want to say something about integrative approach. Now, what is that integrative approach? Is adding modern medicine to Ayurveda is integrative? Or vice versa is integrative? I would not say that, because the approach is completely different. When you are talking of modern medicine, we talk of disease-based approach. When we talk of integrative, we talk of holistic healing approach. So this approach is different. Swasthya Swasthya Rakshanam is a holistic approach. Disease prevention is the next step. So holistic healing, recovery, repair, restore the wholeness of the mind, body, soul. This is what is the idea of integrative approach. And this approach today, we are going to do an evidence-based approach. Now, just because it is being used in Ayurveda, therefore we are using based on what are we basing our, this is an experiential wisdom which is coming from thousands of years. Now we can take this Aptavachan, experiential wisdom, as one of the evidences. So therefore, that's the one most biggest evidence we have. And today, we can have the scientific evidence on all these parameters. Now, I had a very interesting experience. One of my students referred to me a case who had 4 abortions. And that abortion were supposed to be because of toxoplasma. She was highly positive for toxoplasma. This I'm telling you a story of almost 3 decades back, or more than that. One of my registrar referred to me the case. And I had nothing else to offer to him at that time. There was no treatment for toxoplasma known. So I said, let me check Sushruta Samhita. In Sushruta Samhita, there is a whole chapter dedicated to prevention of pregnancy losses. Now, when I looked into the subject, I found there were 50 drugs, 50 herbs used in different months. And then I said 50 drugs is not possible. So I tried to select few drugs. And then I started working on them. So I said, based on Rasavirya Vipaka, now we need to select drugs which are Madhura Vipak, Madhura Ras, and Shita Virya, most of them. And the first choice was Shatavari. Now you can see Shatavari, Rasavirya Vipak, you can see on the screen, and it's highly nutritious. And there are so many nutrients in that, beta carotene, vitamin A, anti-ADH property, antioxytocic property. It's a powerful antioxidant and immunomodulator. It helps in stimulation of prolactin. So with all this, I thought Shatavari could be the very good option. Vidari, again, a very nutritious, rich in beta carotene, vitamin A, magnesium. Shringatak is the third one, which is a powerful antioxidant. Manganese, mitochondrial SOD. Then we thought of Amlaki as another Rasayana, which is again a very powerful nutritional agent with vitamin C, K, calcium, magnesium. It's an anti-aging agent par excellence. And there is so much of vitamin C in it that 8.7 milligrams of Amlaki is equal to 100 milligrams of ascorbic acid. So therefore, looking at all these properties, we selected Amlaki. Then Bala is another which contains micronutrients, potassium, and antipyretic activity. Ashwagandha Now, when he came to Ashwagandha, it's a Madhura Rasa, Madhura Vibhaga, but it is Ushnavirya. But it is Snigdha. So, therefore, we selected Ashwagandha, which is again a very good immunomodulator, very good immunostimulant, antioxidant, and improves thyroid function, GABA mimetic activity, micronutrients like iron, zinc, iodine. So, these are all present in this. Then we selected Yashti Madhu. Again, this Yashti Madhu has been used from 9 months. In 7 months, it has been used by Sushruta. So, like that, we selected the various drugs based on these factors. And it's an excellent rasayana and very good immunomodulator. And it is antiviral. Very importantly, it is antiviral and micronutrients, interferon, etc. Then Anantamul Sariva. Anantamul Sariva is the most important of all this because it's Rasadhatu Shuddhikara. And this particularly important from the point of view feto placental circulation. And Gokshuru. Gokshuru is a mild diuretic. It is a very mild diuretic. Apart from it being a powerful nutritional agent. And what is most important is it increases the glomerular filtration rate, GFR, but it does not cause the imbalance of the electrolytes. So these are the various factors on which we selected these drugs to make into Sujat. Now, what are the various micronutrients in this? I've given a list of that: beta carotene, vitamin A, vitamin C, calcium, potassium, magnesium, manganese, zinc, iron, iodine. These all are present in Sujat. Now, various amino acids, this study has been done from arginine, histidine, glutamine, isoleucine, leucine, etc. Number of the amino acids. And there's a powerful immunomodulator, differential modulation of cytokines, activation of polymorphonuclears, macrophages system, then adaptogens, non-specific resistance. So all these various herbs which we used in this are having these properties. So after doing this, we next went to find, are they really, there's a good powerful antioxidant activities there or not? So the most important substances which we test for antioxidant activity are glutathione and vitamin E. So in comparison, how does this Sujat? So Sujat showed a very superior action when the study was done at BARC, Cell Biology Department. This paper is published, and we have done a trial of this drug at St. George's Hospital. Now in this, we have two units. One unit where I was the head, the other unit, we had given the normal treatment, what everybody gives in the modern medical college. And we studied almost 900 patients, little more than 900 patients. And here are the results, which shows when you compare the control to the study cases with Sujat, almost 300 grams birth weight improvement. So that is something really phenomenal when you compare to that of the controls where the modern medicine treatment was given. Even the preterm delivery rate was less. It was only 6.25 compared to 9% in the control group. IUGR was 7% in this group compared to controls 12%. And stillbirths and neonatal deaths were 2.25% compared to 3% in the control group. And full-term normal delivery 84.5% compared to 76%. So in all this, a big study like this showed that we have almost a very good improvement in all parameters. Now, in my last 30 years of practice with Sujat, I have not got any serious problems with PAH in my practice. PAH, if you started Sujat early in pregnancy, is never an issue in all the cases. So this is something very, very important for you all to learn. Sujat can help in prevention of pregnancy-induced hypertension. Now to come to the end of the talk, is Ayurveda a science? Now Jan Fagan, Chief Scientific Officer of Licensing Authority of Testing, on 2nd February 2002 says that your traditional knowledge base appears to me the most valuable resource that India has. If you look at the knowledge content in Ayurveda and other Vedic traditions, you'll find a whole system that has been greatly undervalued at this point of the time. And this body of the knowledge, I feel, has a potential to transform India and the world. This is what the people think about Ayurveda, some of the very intelligent people. And I hope I have tried to explain how Ayurveda, with an integrative approach, when we say that whatever we are trying to do is based on the facts and figures. And when we do this treatment, we can get the results. And with this confidence, I think people should take up integrative medicine. This is what I understand. Thank you all very much. I am open to any questions. Thank you.
Thank you so much, sir. It was really very informative. As I could pick it up, it is all in the mother's womb, and we should be adopting a holistic approach during pregnancy, including the Ayurveda, the modern part, the best of all. I request everyone to please note down their questions. We will have an interactive session at the end, so we can ask that time to the respective panelists. Please note down your questions. I think we can move on to the next panelist. Dr. Amit, should we move to the next panelist?
Yeah, please, definitely, Dr. Shalini. Please go ahead.
So I would request Dr. Sheetal to kindly present her talk in front of all of us and enlighten us with the knowledge. Dr. Sheetal, please.
Yeah, you would like to do the, you can unmute yourself, Dr. Sheetal. Yeah. You can do the slide share. You have some PPTs. Yeah, below you can see a green color share screen.
Yes, sir.
Yeah, and you can open up your PPTs and
One sec, sir. I will.
yeah. Dr. Sheetal will be guiding us today with regard to the Panchkarma in the pregnant women, and she has a lot of experience in this field for last 12 to 18 years. So we are very happy and that she will be able to guide all the women in this regard. Before Dr. Sheetal comes up with the preparation, sir, in the comment box, we have been getting a few of the comments. There are many of the practitioners, there are many of the participants who have been giving the feedback that they have used the Sujat during their pregnancy, sir. So, and the weight of the baby was 4.2 kgs. So, so you have a lot more followers, sir. Yes, sir.
Good, good.
Yeah, Dr. Sheetal, so we are ready. You can go ahead, please. Yeah.
Okay. Thank you very much, sir. Namaskar to all. It is my gratitude to express my thanks towards the organizing committee for inviting me to my very first talk on the Panchkarma for Supraja. Sir has spoken very nicely in front of him. I am very small speaker, but I would try my level best. My topic is a bird view on Panchakarma for Supraja. Sujat, I am the very much fan of Sujat. Actually, I also used for my patients, and it gives very much result for BOH when patient has very bad obstetric history with Panchakarma. BOH cases will definitely cure. Introduction: pregnancy should be by choice, not by chance. Nowadays, couple starts their family after settlement, that is after 30 to 35 years, and want 1 or 2 kids with good looks and talented and creativity. For life security, we invest insurance to a child. Taking help of Ayurveda will act as an insurance of healthy kid. Ayurveda can act as an insurance for a healthy kid, where new generation is very keen to have only 1 child or 2 child. What is needed to get a healthy child? Ayurveda always talks about wellness rather than the illness. Acharya Sushruta very beautifully explained about Garbha Utpadak Samagri. That is the factors needed for formation of fetus. Acharya Sushruta compared this process with the germination of seed. As we all know that for a beautiful plant, we need 4 factors like Ritu, Kshetra, Ambu, Bija, in which Ritu is season, proper season, Kshetra is the fertile land, and Ambu is the nourishment or nutrient, and Bija is the seed. In same way, when we need the healthy progeny, fertile period, that is Rutu in the Stree, Kshetra, that is uterus and reproductive organs, and Ambu, nourishments, it is totally depend on a woman, and Bija, it is sperm and ovum. How to get a healthy kid? Our Hindu tradition is a very scientific. There are so many sanskaras explained in Hindu tradition, but there are 16 major sanskaras we all follow. We should follow. To lead a harmonious life, these sanskaras are very necessary. Among these 16 sanskaras, Garbhadhana sanskara is the in which that sanskara explained to get a child by choice and with the physically, mentally, and spiritually healthy one. In Charak Samhita, Sharir Sthana, Garbhadhan Sanskara is explained as Atha Apyato Stri Punso Sniha Swedabhyam Upapadhya Vamana Virechanabhyam Sanshodhe Kramena Prakurti Apadaye Cha Astapana Anuvasana Abhyam Upachare. So both partners should take the Panchakarma for the getting the healthy child. As Panchakarma is very scientific and it has the cellular level purification. All toxins which are accumulated due to stress and sedentary lifestyle can be purified by the Panchakarma. By performing Panchakarma, the absorption of the nutrients increases by the multiple folds. What's told that the IUGR is main due to the insufficient nutrition by placenta. So this can be avoided by Panchakarma. Hormones remains in balanced state due to Panchakarma. Thus, Panchakarma before conception gives healthy ovum and facilitates conception, provides proper implantation, and helps to the maintain full-term healthy pregnancy. When to start Garbhadhana Sanskara? The plan should be start 3 months prior to the conception. Snehna, Svedana, Vamana, Virechana, Basti, Uttar Basti for the healthy endometrium, and Shirodhara for mental well-being. As sir has told that the stress, that is limbic system, is very much close to the IUGR. To overcome this, Shirodhara will definitely helpful. To conclude, pregnancy should be by choice, not by the chance. Panchakarma is like insurance for the healthy baby. Thank you very much. Thank you very much, sir, for inviting me for this talk, speak. Thank you very much. And I will conclude my Garbhadana Sanskara.
Thank you, Dr. Sheetal, for letting us know that how Panchakarma can help us for Suprata. I'll be...
Ma'am. It is actually Panchakarma is the very scientific method by which biopurification takes place, ma'am. As I told that Sushruta has mentioned the Shrutu, Kshetra, Bija and 4 factors for the very important for the conception or to getting the healthy embryo. If are all 4 factors present in the woman, if we done Panchakarma, it will be helpful for the healthy baby. Do you get me? Hello? Hello?
Yeah, we can hear you. Yeah, Dr. Sheetal.
हाँ,
Yeah,
एक्चुअली मैम जो बोल रहे हैं ना कैसे करता है पंचकर्मा, तो जो सर ने अभी IUGR के बारे में हमको बोला था कि क्या क्या रीजंस हैं, जैसे इम्प्रॉपर एब्जॉर्प्शन ऑफ न्यूट्रिशंस या न्यूट्रिएंट, उसके बाद उन्होंने बोला था लिम्बिक सिस्टम जो इमोशनल स्ट्रेस है। तो जो जब हम पंचकर्मा देते हैं तो आजकल जो हमारा लाइफस्टाइल बदल गया है, हम जैसे हम जंक फूड खाते हैं, हमारा कोई भी काम दिनचर्या से नहीं होता है। जैसे आयुर्वेदा में बताया है हम साइकिल रहना चाहिए, जैसे फिजियोलॉजिकल साइकिल रहता है वो हम मेंटेन नहीं करते हैं। जब हम पंचकर्मा करवाते हैं तो उसका एक साइंटिफिक वे होता है, जैसे दीपन पाचन है, स्नेहपान है, उसके बाद हम वमन करते हैं। आफ्टर बैलेंसिंग ऑल दोषा, तो जो भी सर्कुलेशन है हमारे बॉडी का, एंडोक्राइन सिस्टम है या कुछ भी सिस्टम है, वो प्रॉपरली शुरू करता है। अगर एक बार हमारा फिजियोलॉजिकल सर्कल करेक्ट से काम करना शुरू हो जाता है तो उसका रिजल्ट तो अच्छा ही आने वाला है। तो पंचकर्मा डेफिनेटली है गर्भ संस्कार, प्रेयर टू कंसेप्ट। Hello.
Yeah, we are able to hear you. Yeah, Dr. Sheetal, you would like to add something more, or I can?
You can proceed, sir.
Okay.
Sir. Next
So
question.
back to Dr. Shalini. Yeah, you can. Are you there, Dr. Shalini? Think there is some connection problem. So
maybe.
yeah.
I think she.
Maybe there is a network issue, so she has dropped from the system. So no problem. I'll continue with the further part. And thank you to Dr. Sheetal for guiding us on this regard with the Ayurveda therapies. I'm now going to give us guidance with regard to the yogic approach for the pregnant ladies. Now, if we see from the angle of yoga, we have divided the body into 5 different virtual sheets, which is known as Panchakosha. This is the reference from Taittiriya Upanishad. So the food which we eat forms the physical body, which is known as the Annamaya Kosha. In the same way, as sir was been talking about, the oxygen forms to be the major energy for all the living being, in the same way, which we name as the pranamaya kosha. The different desires which the individual has to do or not to do of certain things is all in the man, is known as the manomaya kosha. The fourth virtual sheet is the intellect or the Vijnanmaya Kosha, which help us to guide what things one should be doing or one should not be doing. And finally, the fifth sheet is known as the Anandamaya Kosha. The Anandamaya Kosha is the blissful sheet. So if you are able to have the balance in the four sheets, the individual can be blissful or can be in a happy mode. So before the conception, if the girl is already doing the yoga, she will be having a balance at both the physical and at the mental level, and at the social and the emotional level. So these things start much prior, even when the conceive. So what we do here is we have divided the yoga practices as prenatal and antenatal. So what we do here is कि फर्स्ट 3 महीने जो होते हैं, उसको हम फर्स्ट ट्राइमेस्टर में डिवाइड कर लिए हैं. वो उसमें अलग अलग सेट ऑफ प्रैक्टिसेस बताई गई है. चौथे से छठे मंथ तक की जो प्रैक्टिसेस है वो सेकंड ट्राइमेस्टर में आ जाती है, और 7वें से 9वें मंथ की जो प्रैक्टिसेस है वो थर्ड ट्राइमेस्टर में आ जाती है. तो इसमें किस तरह से है ये प्रैक्टिसेस, इस तरह से बताई गई है कि जैसे इसमें लूजनिंग प्रैक्टिसेस हैं. लूजनिंग प्रैक्टिसेस इसीलिए हैं क्योंकि आपके शरीर में जो स्टिफनेसेस हैं उसको हम रिमूव कर सकें. तो इसीलिए इनिशियल स्टेज में देयर आर वेरी स्लो प्रैक्टिसेस which will involve the movements of the small joints and of the bigger joints. सेकेंड जो है इसमें आपको ब्रीदिंग प्रैक्टिसेस हम करवाते हैं इन द फॉर्म ऑफ प्राणायाम. तो प्राणायाम में जो प्रैक्टिसेस करवाई जाती है उसमें आपको लॉट ऑफ सटल एनर्जी इन द फॉर्म ऑफ प्राणा विल बी गिवन टू द इंडिविजुअल एंड टू द ग्रोइंग फीटस ऑल्सो. इसी तरह से इसमें कुछ कुछ सूर्य नमस्कार की प्रैक्टिसेस भी कराई जाती है. इट वेरीज फ्रॉम केस टू केस. सूर्य नमस्कार को जो है हमारे एस व्यासा जो यूनिवर्सिटी है, स्वामी विवेकानंद योग अनुसंधान संस्थान, उन्होंने चेयर सूर्य नमस्कार भी इंट्रोड्यूस किया है. तो चेयर सूर्य नमस्कार में ये उनके लिए फायदेमंद है जो कुर्सी पर बैठ के सूर्य नमस्कार कर सकते हैं. साथ ही साथ में इसमें कुछ आसन्स दिए बताए गए हैं. और फाइनली जो है वो मेडिटेशन की प्रैक्टिसेस. मेडिटेशन की प्रैक्टिसेस इसीलिए ज़रूरी है क्योंकि अगर प्रेगनेंसी के दौरान वहाँ पे बहुत सारा, जैसे सर ने बताया कि 4 to 14th वीक में जो है वो एक्चुअल डेवलपमेंट होता है, और इस समय अगर तनाव है वो प्रेग्नेंट लेडीज़ को, तो वो असर करता है ग्रोइंग फीटस पे भी. तो इसके वजह से साथ ही साथ में जब डिलीवरी के समय जब जाते हैं तो उस समय अगर मांसपेशियाँ ठीक से, पेल्विक और हिप की आपकी मसल्स अगर ठीक से स्ट्रेच नहीं होती हैं तो नॉर्मल डिलीवरी नहीं हो सकेगी. इसीलिए ये जो स्ट्रेचिंग जो लूजनिंग प्रैक्टिसेस जो कराए जाते हैं पूरे 9 महीने में, दिस विल हेल्प टू रिड्यूस द लेवल ऑफ स्ट्रेस एंड दिस विल आल्सो हेल्प टू हैव द नॉर्मल डिलीवरी. अगर हम अपने पिछले 20 साल के कैरियर को देखें तो वी हैड मोर देन 100 लेडीज जिनको कि हमने ड्यूरिंग प्रेगनेंसी योगा कराया. In fact, we have a team of almost 80 qualified UGC trained teachers. और इनके देख रेख में हमने जब ये योगा की प्रैक्टिसेस कराई तो हमने देखा कि मोर देन 80 to 90% ऑफ दिस लेडीज ने डिलीवर जो है वो नॉर्मल बेबी की एंड हेल्दी बेबी की. तो इस तरह से सर ने जैसे बताया कि अच्छा उनको खान पान दिया गया ड्यूरिंग प्रेगनेंसी, साथ ही साथ में जब हम योगा उसमें जोड़ देते हैं तो चांसेस ऑफ हैविंग द नॉर्मल एंड हेल्दी बेबी इज मच मोर देयर. तो ये इस तरह की प्रैक्टिसेस जो है इस साथ साथ में इसके इट गोज वेल विद द प्रेगनेंसी. या सो ओवर टू यू डॉक्टर शालिनी.
Thank you, Dr. Amit, for telling us about yoga in pregnancy. We all know yoga is helping us. People have come to know the importance of yoga in our day-to-day life. But how it can help in pregnancy was wonderful knowing, because normal delivery these days is rarely seen. So if we practice yoga and the pelvic muscles are strong enough, then we can have it. And definitely stress, which you told us about. Thank you so much. We are coming to the last speaker for today, Dr. Shelar. Ma'am, can I request you to please start your talk?
Dr. Swati, have you joined us? I think she had some cases which she was looking for. So what I'll do is I'll open up for the questionnaire which has come up from the students and from the general public. So I'll start with this so that maybe Dr. Swati can then wind up and give us the briefing about the talk. So the first question which has come up from the audience, I'll read that. It says that many times it has been seen that in spite of all the Garbha Sanskar procedures followed, nutrition, diet, antenatal care, certain congenital or intrauterine development anomalies take place. So in such scenario, a lot of mental trauma of patients and family take place. And later on, there also deprecate the affected parents and in some cases the child's capacity to handle the future. How these can be handled as days, months and years progress. So this is the first question which has come up. So I'll request Palip sir to guide us on this.
Sure. Now, the question of when you talk of the congenital anomalies which are there are two parts of that, the congenital anomalies. Whether is this a genetic problem or is this is because of some other issue like infections or any other reason, some chemicals or some sort of a thing, which you know that a drug was in the market many years ago, and use of that drug caused babies without limbs, pocomalia. Now, like that, there can be instances where there can be problems because of certain drugs, certain environmental factors, and of course, genetic, which I already explained. When the mix match occurs of the genes at the time of formation of genome, some factor affecting can alter that and can end up in genetic abnormality, which can be defective. Some of the defects, either mental or physical defects, could be there. And this part, probably what I said in my talk, giving the Garbha Sanskar, Garbhini Paricharya, and pre-pregnancy counseling, pre-pregnancy nutrition, getting a good mean body composition for the mother is stress-free life for the mother. These all factors need to be taken into consideration. As you said very correctly, what Sushruta said, Harsha Ullas, before planning the pregnancy is one of the most important things, and how this whole thing can affect. That your mental disposition is one of the most important factor, and therefore all these sanskars can be of a good use with the good nutrition, good environment. Thank you.
Thank you, sir. We also have Dr. Beni with us from Gauhati Ayurveda College, and I'll request Dr. Beni if she can come up with the second question. In the meantime, I'll request Dr. Shalini to share her experience with the viewers. What was her experience during her pregnancy with yeah.
I was waiting for this time to come because I really wanted to tell everybody, like in first pregnancy when I conceived, I told Mamta Didi that okay, I have conceived and all. So she guided me about Masanumasic Paricharya complete, the medicines, the supplements, and also Sujat, she told me how good and effective it is. I personally took, and two daughters, both are very healthy, physically, mentally, everything. I'm so very happy, and I give it to all to this, the whole monthly paricharya which was followed, and especially Sujat. Then I also came across two cases I remember. One was of torch, so where we gave torchnil and Sujat. I discussed it with Dr. Mamta, and she told me about this, and I used this on my patients, and she had two miscarriages before, and after taking this medicine, she delivered a healthy baby. So this was a very, even I was feeling very positive about the Ayurveda practice which we do, and definitely happy. Other second case also, there was something happening which was not known the reason, but she was also having miscarriages, and we followed the whole monthly masanu masik paricharya along with Sujat, and as a precautionary measure I gave torchnil also, and it was again a very good thing. So two cases I clearly remember because they gave me a full follow up, and they came with the baby to me that we thank you so much, doctor. So that was a very happy moment. Thank you so much, sir, for giving us this beautiful product. Thank you so much, sir. And thank you to Ayurveda giving us this monthly the regimen which most of us don't follow, but I personally followed, and I know the results of it. I request everybody to just spread this message and themselves follow it.
Thank you, Dr. Shalini, for sharing your experiences. That was very motivating for others also to follow the same. And we have the learned panelist here to guide us, Dr. Palip sir and Dr. Sheetal madam. Madam, Sheetal madam, this is a question from the audience for you. The question goes, can we interpret the Basti Chikitsa during the 8th and the 9th month of the pregnancy, which has been said that it helps in providing micronutrients through the enteric brain, that is the gut brain system, to the fetus? And does it also help because we know that it helps in the sukha prasava? So Dr. Sheetal, are you there?
Yes, sir.
Yeah, should I repeat the question for you?
No, sir. No, sir.
Okay.
I would like to answer.
Please, yeah. So please guide us.
Sir, we in classically they told that we can use the basti full after the 8th month, after completion of 8th month, for the healthy normal pregnancy or to the easy pregnancy, painless delivery. Sorry. So we can use the Anuvasana Basti. In our clinic, we use it regularly with the Dashamuladi Taila. It gives very best result, and इससे ना बहुत सारे पेशेंट्स नॉर्मली डिलीवर्ड हो जाते हैं अगर कुछ बहुत बड़ा मेडिकल कॉम्प्लिकेशंस नहीं है, जैसे ऑलिगोमेनोरिया है, सॉरी पानी भी कम है थोड़ा सा, तो पेशेंट्स नॉर्मली डिलीवर्ड हो जाते हैं. डेफिनेटली वी कैन यूज द बस्ती इन 8th and 9th month. आई यूजुअली यूज इन माय पेशेंट्स.
Thank you, Dr. Sheetal. There is one more question which has come up. So this open up this question for both Palip sir and Sheetal madam. Is there any role of Prajastapan Mahakashaya in Garbhini Paricharya for the outcome of Sujat baby? If yes, how these drugs are applicable in clinical practice? Yeah.
सर अभी जो सर ने प्रेजेंटेशन दिया था उसमें मोस्ट ऑफ द ड्रग्स आर फ्रॉम प्रजास्थापन द्रव्यास, तो डेफिनेटली प्रजास्थापन कैन एक्ट एज अ सुजात और सुप्रजा. It will act.
Yes,
Okay.
yes, yeah. Within the presentation, sir has almost covered up the major drugs.
With integrative approach, he told very nicely. So there is no question about that action of that Prajasapan Gana.
The one more question has come up. How can we justify Punsavan karma during the antenatal period?
It is very difficult, sir. I would like to hand over to Palip, sir.
ये पुंसवन जो है पोदार हॉस्पिटल में हम लोग करते थे बहुत साल. जब हमने वो डिपार्टमेंट का इंचार्ज थे तो वी ट्राई टू फाइंड आउट कि what is the prevalence of the results. So we wrote letters to so many people who underwent the treatment. But unfortunately, we found the letters came back saying that wrong address. Now, those people who came for the treatment did not want to reveal their correct address. It means that. Or they might have left that place. One of the two possibilities, but we don't know. We, in fact, failed to get any response to our effort to find out really what is the outcome of our treatment. So, in absence of that sort of a response, it's very difficult to say whether it is useful or not. But you know, the testosterone levels rising is the reason for the male reproductive organs to form. Otherwise, basically, is all the female reproductive system comes into the effect if the testosterone levels do not rise. Now, these all depends on your XY or XX, which is determined right at the time of genome formation. So therefore, it is only about the development of the genital organs. Suppose if by any chance the testosterone levels do not properly come up for any reason for the intrauterine development, in that case, the genital organs become feminine. So this is what I understand. But in fact, I don't know whether Punsan Vidhi was more a social thing than anything else. Probably that gave some empowerment to the woman in some way, some importance given to the lady who is pregnant, beyond which I don't see any scientific correlation. So far, which I have tried, I have failed in finding out answers. Let me be honestly telling you that.
For giving the insight about the work which has been done and your fair ideas on the same. So over to you, Dr. Shalini. Yeah.
Can we have a take-home message from the panelists now, sir? Dr. Paleb, sir, from you we will start. A take-home message, line or two, if you can just tell us.
Take-home message is very simple because many people tend to think Ayurveda is jadi butti, may not be of significance. In fact, in my early days, I was of that opinion. But then, you know, the times have changed with experience, and I stand to get corrected after my own experience. So I think more people will come out with good experience. And after all, our ancient system with so much of experience and wisdom should not be wasted, and it should be brought up into a way that we can scientifically explain. Now, this has been my effort to bridge the gaps between the systems. Now, for example, if I say carbon, hydrogen, nitrogen, and oxygen, these four elements are basic for life. People will say, yes, we know that. That is the chemistry. But if I told people that Panchamahabhut are the basis for your life, people say this is not my cup of tea. So, but unless we understand what these Panchamahabhut stand for, in terms of today's modern knowledge, but that is only possible if we understood what our ancient people wanted to say. Now, they said, Shabda Gunam Akasham. The sound is an energy. Without sound energy, nothing in the world can come up. No life can come out without sound. Tej is another, energy, which is again light and sound. I mean, light and heat. Light and heat. So this light and heat is basic to our whole life, without which nothing can happen. The entire metabolism is based on this. And then comes Prithvi, Gandhavati Prithvi. Now, what is Gandha? You must have studied in your 12th standard organic chemistry. In organic chemistry, there were two parts. One is aliphatic and other is which is the other one?
Mesophilic.
Anyway, what I mean to say is, if you know that carbon is basic to all the aromatic chemistry, sorry, I was wanting to say aromatic chemistry. So it is Gandhavati means aroma. Aroma is related to carbon. And after all, carbon is basis to your life. When we end up our life, we end into carbon. Carbon and silicon of the earth, they have the same chemistry. So when you try to understand water, H2O, and Vayu is nitrogen 80% and 20% oxygen. And basically the same thing, if you want to create DNA in a test tube, if you create a DNA in test tube, you require all these elements. So Panchamahabhut becomes very relevant, but we need to bring this knowledge and that knowledge together. And without bringing this and that knowledge together, you cannot make the other person to understand. If somebody speaks French and you speak English and they don't go well with each other, isn't it? So therefore, we need to have equivalent of this to that. And then you can merge both the languages. Without merging the languages of the two, you cannot integrate. So integration is more towards the integration of the sciences, the knowledge base. If we integrate the knowledge base, then I think it becomes very easy to understand what is happening. Same thing about Vata, Pitta, Kapha. Now, when you say in the body there are only three mechanisms. What are the three mechanisms? One is regulatory mechanism, other is a structural mechanism, third is transcriptional mechanism, one to other. These are the only three mechanisms. And Vata, Pitta, Kapha, or Vata is regulatory mechanism, Pitta is a translational mechanism, and Kapha is a structural mechanism. Now, there are so many subsets of each of that is a different issue. But this is how the whole thing is made up of. So once we understand this, there is not much difference between understanding of the modern sciences and the Ayurveda. The only question is, how do you understand a particular thing in a right direction and right way? That's all. And that's how you can build up your understanding of the science and build up the whole edifice. Is it clear?
Thank you so much, sir. Integrative approach and lead a healthy pregnancy or your life in general.
Yes, that's it. So, do we come to the close of the program?
Dr. Sheetal, would you like to give a
Yes.
go back message?
यस मैम, एब्सोल्युटली. एक्चुअली जब प्रैक्टिस करते हैं तो इंटीग्रेटिव बोले तो आयुर्वेदा और एलोपैथी, 2 आयुर्वेदिक मेडिसिन दे दिए, 3 एलोपैथिक मेडिसिन दे दिए, तो इट इज नॉट इंटीग्रेटिव. जो सर ने बोला है वो इंटीग्रेटिव है. अगर हमारे लोग, हमारे आयुर्वेदिक पीपल अगर हमारे साइंस पे या शास्त्र पे ज्यादा ध्यान देंगे तो बहुत अच्छा होगा. कौन सा भी शास्त्र हो वो ह्यूमैनिटी के लिए सर्व करने के लिए रहता है. ये एलोपैथ है या ये आयुर्वेद है या होम्योपैथ है, ऐसे करने से बजाय अगर हम इंटरडिसिप्लिनरी अप्रोच करके अगर होलिस्टिक हेल्थ कैसे मिलता है उसके ऊपर ध्यान देंगे तो अच्छा होगा. तो मैं सारे आयुर्वेदिक फिजिशियंस को रिक्वेस्ट करूंगी कि डू बिलीव इन आवर साइंस, डू पंचकर्मा. पंचकर्मा is the best way for purification, and after that Sujat and all very scientifically proven drugs are there for next measure. So please believe in Ayurveda and practice Ayurveda. This is my message. Thank you, ma'am.
Thank you so much, ma'am. Dr. Amit, few words from you also. I think he's having a network issue. But as per my understanding, we have lot of wisdom, I feel, in form of yoga and Ayurveda. We should be taking the best of it and do lot of research so that we can, as sir said, in their language, उनकी भाषा में समझाना है. तो हमें अच्छे से रिसर्च करके अपना रिजल्ट्स प्रेजेंट करना है, so that हमें बताना ना पड़े, खुद ही लोग कन्विंस हो जाए seeing the results of the studies. So all the Ayurvedic doctors, the physicians, the research people, please do more of research, more publications, so that we can give proof through our work, not words. I would like to present the vote of thanks now, as we are coming to the end of this program. I would like to thank all the panelists, doctors, professors of the Government Ayurvedic College, Gauhati, who are present here, to making it a great success by giving their attendance, the presence and their participation. My sincere thanks to Dr. Bishnu Prasad Sarma, Sir, Principal, Government Ayurvedic College, Gauhati, PTSR Department of Government Ayurvedic College, Gauhati, Dr. Beni, Dr. Balen Beshe sir, Dr. Khaklari ma'am, Dr. Deepak Goswami sir, all of you for your never-ending support to us. I would like to extend my gratitude to Bharat Vikas Parishad Konkan Prant, Kalyani Shakha, Vivekanand Health Global Gauhati, and Dirgayu Treatment Center Mumbai for their support in conducting this webinar so smoothly. Dr. Amit and Dr. Mamta, who are the backbone of this whole idea, really heartfelt thanks to them. I think he's not connected somehow. He's there. He's there. He's there.
Yes, I'll just get connected. Yeah. Okay. Sorry, there was some problem, the network. Yeah. So it was good to hear from Dr. Sheetal about the take-home message. So I'll just give a small message. In fact, I will also update that there is a very good book by Palip sir, that is Scientific Foundation of Ayurveda, which we have read during our during the students' days. So I'll recommend everyone who would like to have a little more insight can always have the book. In fact, sir's second book of Dosh Dhatumal is also coming up for the publication. बाकी सब लोग जो सुन रहे हैं, मैं उनको ये कहना चाहूँगा कि हम जो योगिक प्रैक्टिसेस करवाते हैं ड्यूरिंग प्रेगनेंसी के, हमने देखा है कि आजकल जैसे यूट्यूब्स में बहुत सारे प्रीनेटल और योगा के ड्यूरिंग प्रेगनेंसी के बहुत सारी प्रैक्टिसेस आ गई हैं। लेकिन क्या होता है कि जैसे सर ने भी बताया कि ये एक साइंस है, इट हैज टू बी इंडिविजुअलाइज्ड। तो अगर आप कोई ड्यूरिंग प्रेगनेंसी अगर योगा करना चाहते हैं तो मैं स्ट्रांगली रिकमेंड करूंगा कि आप अपने डॉक्टर की सलाह लीजिए। जैसे हम भी यहाँ पर जब योगा थेरेपी करवाते हैं तो हम क्या करते हैं कि एक डॉक्टर गायनेकोलॉजिस्ट जो रहते हैं उनकी सलाह लेते हैं, और फिर उसमें डूज एंड डू नॉट्स जो है उसकी लाइन ड्रॉ की जाती है। हो सकता है कि किसी को प्रेगनेंसी रिलेटेड हाइपरटेंशन हो या किसी को डायबिटीज हो, तो उसमें ये जरूरी है कि उनको फिर ये ज़्यादा फायदा करेगा। क्योंकि जैसे कोई औषधियों का होता है कि औषधियाँ अगर फायदा करती हैं तो नुकसान भी हो सकती है। इसी तरह से योगा प्रैक्टिसेस भी है। तो एक अगर ट्रेंड योगा थेरेपिस्ट के साथ में और एक डॉक्टर की प्रोटोकॉल के साथ में अगर ये हम करते हैं तो या ओवर टू डॉक्टर शालिनी।
Thank you so much, Dr. Amit. Precaution is all should be there, and under guidance things should be done. चाहे योग हो, चाहे आयुर्वेदिक हो, मेडिसिन कुछ भी, वो अपने डॉक्टर की सलाह से ही। प्रेगनेंसी वैसे भी एक बहुत स्पेशल सिचुएशन या कंडीशन है, तो हमें और ज़्यादा ध्यान रखना चाहिए। एंड जब आप डिस्कनेक्टेड थे मैंने थोड़ा वोट ऑफ थैंक्स किया था टू सेव द टाइम ऑफ द पैनलिस्ट्स हु हैव स्पेयरिंग देयर सच प्रेशियस टाइम. I would like to thank one and all again. If I've missed someone's name, I really thank them also. And thank you, Dr. Amit and Dr. Mamta, for being the backbone of this whole webinar which we are conducting. Thank you for letting me moderate. Hopefully, I've tried to do it as per my best capabilities. Thank you so much for the wonderful session, one and all. We would like to meet up again in the next episode of this webinar series on integrative health for all. Thank you.
Yeah, what we'll do is we'll end with the Shanti mantra. So I'll request everyone to join the palms and they can close the eyes. We will say Sarve Bhavantu Sukhina all together. Om Sarve Bhavantu Sukhina Sarve Santu Niramayah Sarve Bhadrani Pashyantu Ma Kaschit Om Shanti Shanti Shanti